Good evening, everybody. Today, this is the first lecture of this whole symposium, this whole course that we are planning to do over a period of 3 months. It would be a journey of togetherness. We would all be talking more and more about what is myopia, what is the problem statement in myopia, what is progression, how much would we call it as progression, and why everybody, or rather, there are so many people who are coming into myopia, why more and more data is coming in myopia, why it is a problem, what are we expecting in future, how did it all start. uh, I would be with you for another 3 months together, and this is basically a very formative, very starting, very basic lecture. This video is to know about myopia, to understand why at all this is important, not only for present generations but for future generations. What to expect, and what exactly are we treating, whether we are treating progression or we are treating myopia. Myopia is being treated since years, we all know that, and there are different surgeries. There are few friends of mine who actually said that, if you start this all myopia problem or myopia progression, there would be a time when actually there will be less laser surgeries or less refractive surgeries. And my response to him was pretty simple, that actually it would reduce the complications which myopia can cause, but at the same time, we are not really trying to eliminate, or rather, we cannot eliminate myopia. We can only reduce the progression of myopia at this point of time. So, yes, maybe when we talk about pre-myopia, so there will be a different lecture on pre-myopia where I would be talking on how relevant or how important it is to prevent pre-myopia, because once the myopia starts, it is going to progress. But if you strike at the right time, which is pre-myopia, it is very easy to really reduce the whole burden of myopia, the whole prevalence of myopia that can occur. So I would just go and talk about a small thing about what is myopia. We all know it is a type of refractive error, where other refractive errors are hypermetropia and astigmatism. Myopia is short-sightedness, which means a condition in which objects which are close will appear clear, but not the far ones. And how do you treat myopia is by the fact that you put a concave lens on the top, on the front, and this is how you actually treat myopia. So myopia is treated by because the the convergence is more, and in a way you can say that in myopia the amount of dioptric power that is needed is slightly more than what it is needed to converge on the retina, or you can say that the axial length of the eyeball is larger than what it is required, and so you need to diverge the rays, and so you put a concave lens in front, and thereby you divert these rays, and then they focus on the retina. So obviously, in short, myopia can be because of the axial elongation, the growth of eyeball, or it can be because the curvature of the eyeball, curvature of the cornea is more, and that once you increase the curvature of the cornea, the steepness of the cornea increases, and that increases the power of the cornea, or rather the dioptric power of the cornea. Thereby, it forces or converges the rays to focus anterior to the retina, or if the position of the lens, so this is known as curvature myopia. The earlier one which I said was axial myopia, and if the lens moves forward, that would also induce myopia, and that would be indexed myopia. Well, the talk is not really on really on myopia or treatment of myopia, but I thought it would be a good idea to put a small introduction. I know most of us who are into this lecture are have pretty nicely covered and know what myopia is, and this is not something which is truly remarkable or new for them. So what myopia is creating, there is a global burden across the globe. We have seen that myopia is increasing over a period of time, and this is from the classic article of Bran Holden, where he predicted that 50% of the world's population may be myopic by 2050. And I think it was his article which was published in 2006 Ophthalmology, where it was a wake-up call for bulk of the ophthalmologists, bulk of the ophthalmic eye care providers, where they woke up and looked at the fact that most of the population, or rather 50% of the world's population, may be myopic, and almost 9 to 14% of these myopes will be high myopes who would be having other complications like glaucoma, cataract, and myopic degeneration. So the point which we are trying to make here is that every child counts and every diopter counts, because when you talk about myopia, each diopter increase in myopia does make a difference when it comes to the increased chances of glaucoma, increased chances of retinal degeneration, peripheral retinal degeneration, subretinal neovascular membrane. So each diopter really matters. And in this particular, in this particular online course, we would basically be talking about how to cut down, how to reduce the diopters. So it is not that LASIK surgeries will go extinct because of these myopia programs. In fact, more and more patients who would have otherwise gone for high myopia, more and more patients who would have otherwise would have been difficult, or rather the option of LASIK would have been difficult for them, or option of refractive surgery would have been difficult for them, would be made possible by myopia control. So myopia control is actually not really eliminating myopia, it is controlling the progression of myopia. And so each diopter that is being stopped from progressing further does matter. And that is where this whole talk is, that it is to correct and control the myopia progression. Thereby multiple things can be done, and first and foremost obviously is behavioral recommendations. And that is what is the point of this lecture, that before embarking or before talking about any other thing, when the patient first walks into a clinic and you see that the patient is myopic, you have to first see whether he is progressing or not. But before even you talk with the parents, before even you talk with them about progression, you have to tell them that they have to follow certain behavioral recommendations. And what are those behavioral recommendations? First and foremost is to reduce the near work, which is a high risk factor, and second is to sit outdoors. So these two simple, very simple strategies. All the other things which we know from patients, that walking on the grass, or sitting in the sun, all those things, waking up early in the morning, all those things are the behavioral recommendation which fall into these two broad categories of reducing the near work, number one, and sitting outdoors as much as possible. So these two behavioral recommendations should be the cornerstone, should be the beginning of correction and control of myopia. Before we talk about progression, before we talk about what are the other strategies to reduce the further progression of myopia, and whether the patient is actually progressing or not. So there are certain heads why myopia is being discussed in 2025. The prevalence is increasing, and we will see some of the literature across the world, especially in India. The problems, of course, we are all aware what are the problems of myopia: physical in terms of poor visual acuity, emotional in terms of having to use a glass, which is still a taboo, and they have to face a little bit of problems in the school. Economic burden, because the patients who go blind, the patients who need health care, eye care, treatment, the burden of economic burden of glasses, and then the complications that we already know, and we will be discussing it in part 2 of this particular video. And finally, how to prevent it, what can be done to stop the progression of myopia any further. So I think this was the one of the articles which sort of made all this journey possible. And I think this was I'm sorry, this was not published in 2006, rather in 2016, where they could see what were the global prevalence of myopia since 2000, and then they tried to extrapolate this particular data over a period of 50 years, rather over a period of 35 years, as the temporal trends as to what will happen if you see from behind what is the progression and how it is going to progress further and further. So this is the extrapolation curve. You see in 2000 what was the number of people in millions, and gradually it is increasing, and this is high myopes, and this is the myopia trends. So what they are estimating is that in 2010 there were an estimated 1.9 billion people, 27% of the total world's population, who are myopic, and out of that 70 million were high myopes. So the projected increase is almost 52% in the myopes group and 10% in the high myopic group. And this is just to show you how all this will happen. And this you can see it starts from 22% and then 28%, 33%, and this is also because of the generational curve. Now when this particular chart was taken, I think a lot of data from India was missing. A lot of data from India was